as a pediatric physician, can you tell us how you felt when the COVID-19 vaccine became available for adults and children?
Yes, I was very excited. So at the point in time when the vaccine became available was probably about 9 months after the pandemic hit. And so what we had seen in those 9 months here in North Dakota was really a steady rise of infection and death related to um, you know failure of our ability to treat COVID, limited treatment measures that were available in hospital, um, our medical system being overwhelmed and really not having the physical space or the staff to be able to manage the high numbers of people that were needing hospitalization, oxygen, intubation, and additional support for treatment for COVID. And what we saw here in North Dakota really was a steady rise, probably starting in July or August of 2020 through December, through past Thanksgiving of 2020 of increased infection, increased hospitalization, increased deaths. And actually in November, at the height of the pandemic here in North Dakota, we were at the top of deaths per capita worldwide. So really the vaccine was one line of defense that individuals, adults, could use to protect themselves from the pandemic. And as a healthcare provider, it was an additional line of protection that I could have to protect myself and to feel that I could protect my children and family a little bit better, children that at that time could not be vaccinated, from both getting the COVID myself, even with the additional mitigation measures, and passing it on to my children and my family. So I was very excited when the vaccine came out at a hope of, making a turn in the sort of dismal direction that the pandemic was going everywhere, but especially here in North Dakota at that time.
What differences have you seen in North Dakota with regard to the Black community, COVID-19, and COVID-19 vaccine?
That's a great question. And it's really a question that I have both personally and professionally been interested in, which is, part of the reason that we're looking at this. And what we found is very similar to what we found kind of nationally, not just in North Dakota, but we found that disease severity and death, as well as severe sequelae of COVID-19 is much higher in the Black population. And with regard to vaccine uptake, we have found that vaccine uptake here in North Dakota, which is similar to the rest of the country, is less than other populations, both in North Dakota and nationally. So in North Dakota, we're seeing a vaccine uptake rate of around 40%, mid-30, 35 to 40% in adults.
So as a physician who has a heart for community, what do you feel are ways that you as a physician or community organizations can work together to really support the Black community in North Dakota to increase their COVID-19 vaccines and boosters?
That's a great question. And I think it's even a bigger question than COVID-19, right? The question is, how do we create a safe space for education, asking questions, learning information, potentially changing previous belief systems from healthcare providers or trusted community leaders, people that we can trust, that to give us information that we can make well-informed health decisions based off of. I think really that's the missing link. The link is that we need to create spaces um, with trusted individuals for information exchange. And this really needs to be tailored to specific populations. In this case, it needs to be tailored to the Black population. And I think there's a lot, historically that needs to be discussed, unveiled, kind of explicitly sort of mentioned. Historically, there's been a lot of distrust with regard to the medical care system in Black communities. And really that goes back to Tuskegee, for example, where the Air Force workers were being used as guinea pigs to study the natural course of syphilis infection rather than being given treatment that existed. And so we need to create a safe space where we acknowledge and understand past offenses and really understand concerns within the community. And I can, just say personally that despite my medical training, I, came from this same background, and I still, carry a good amount of sort of critical analysis in all of the medical recommendations that are coming out. And for my father, who did not live in North Dakota, as a Black man, he really was very suspicious of the vaccine. And he did not get vaccinated. And he actually died of COVID in August of this year. And so, I speak to you as a healthcare provider, but I am not removed from the Black community in this conversation, or from, the belief system that affects a lot of us in our medical decision making. And I don't think that we can take a cookie cutter approach to public health as it relates to specific populations and feel like we are doing the work of providing care and education. We need to partner, we need to answer questions, and we need to be committed to educating people where they're at, and to, continue over time maintaining a trusting relationship with groups that we can build on. I think that's how we will improve vaccine uptake as it relates to COVID. I think that's how we'll improve, chronic health outcomes as it relates to hypertension and diabetes. I really think we need to take a community-based approach, and it's our responsibility as healthcare providers, as public health officers, as community members to provide this information in a way that is understandable, palatable, and answers, kind of the questions or concerns that may be specific to specific groups or specific individuals.